Hi everyone, Dr. Stephen Davis at Davis Cosmetic Plastic Surgery. The hottest thing to think about going into 2020 is combination therapy. And we've been doing combination plastic surgery type treatments for a very long time, but it's becoming more and more of a thing to do. And I want to give you a couple examples of how you can use it in getting the best results. The first way is just in injectables. When we're doing Botox or any kind of a neuromuscular injection like Botox, Dysport, Jeuveau, those things are going to put muscles to rest for a period of time, usually about 4 to 6 months. But if at the same time you can also inject a little bit of filler in that same general vicinity, you're going to potentiate the effects of both the neuromodulator, like the Botox, and the filler. Perfect example is the area right in here. A lot of people call those frown lines or the 11 lines. When we make that animation, we're actually causing the muscles to form a certain kind of depression of the eyebrows and causing those furrows to happen. When we use Botox, we're going to stop those muscles from making that situation occur. But at the same time, if we could also put a little bit of filler in the area that may already have a little grooving there, you're going to potentiate the effects of both, and you're going to allow the filler to have a longer lasting result because the metabolic rate of that area of constantly being squeezed is going to be diminished. So think about this again. Somebody that comes in that could be you. Come in, you have some furrows there that you see all the time over a lot of years. Just putting a little bit of Botox in that area will make things less aggressive in that squeeze, but it's not going to eliminate the lines that are already there. So what we want to do is put a little bit of filler in there and use a little bit of Botox simultaneously. The filler that you could use in there is something like Restylane or Juvederm. It works great. Another idea about combination therapy that works terrific is talking about laser resurfacing and getting rid of fine lines and wrinkles or just acne scars, things like that. We've been using lasers for years to try to resurface the skin. And when we resurface the skin, it makes the overall look of the skin much better. But what if I told you that by stimulating deeper into the skin, closer to the dermis and below, that we're going to get some of your own body juices, some of that plasma-rich things that we always talk about, and some of the stem cells and growth factors that are inherent in your body to actually fortify the skin and actually make it healthier from below, not just trying to resurface from above. That's another great combination therapy that we've been using, and it's a combination of using a resurfacing tool like a CO2 laser resurfacing, and then using something like radiofrequency microneedling that's going to go below the skin and stimulate some of those growth factors from below. The third example I want to give you is something like liposuctioning and a tummy tuck. A lot of people have lost weight in getting into better and better shape, or they've had multiple pregnancies, let's say, and there's a lot of skin laxity. We can do a tummy tuck to make that extra skin go away, but what if in addition to that, you have some love handles or areas of fat around your bra line or back, and even by just removing the extra skin, you're really not going to get that shape of that 360 reduction that you're looking for. That's the perfect combination that we've been using for a while, but now even more so by doing some liposuctioning into the love handles and to the back, and at the same time reducing the extra amount of skin laxity. So that's the combination I'm talking about. So when you're going to see your plastic surgeon, or if you come to see us at Davis Cosmetic Plastic Surgery, we're going to talk to you about combination therapy, because I think in the end, it's going to give you the best overall result. Thanks very much for listening. This is Davis Cosmetic Plastic Surgery.